Welcome. We're diving into a high-yield review of vitamins, designed to give you exactly what you need for your exams without any of the extra fluff. All right, so here's our game plan. We'll start with how vitamins are classified, then we'll walk through the fat-soluble and water-soluble groups, and we'll finish up with a side-by-side comparison to really lock in those key differences. Okay, first things first, we have to establish the core framework. Understanding this one basic classification is the key because it tells you pretty much everything you need to know about how these vitamins are absorbed, stored, and even excreted. So here it is, the fundamental split. On one side, you have your fat-soluble vitamins. As the name implies, they need fat to be absorbed, and your body can store them in the liver and fat tissues. Then you have the water-soluble vitamins. These guys get absorbed right into the bloodstream, and for the most part, they're not stored long-term. This one distinction is absolutely crucial. So let's jump into our first category, the fat-soluble vitamins, and see how this whole storage thing plays out. We'll kick things off with vitamin A. First up is vitamin A, also known as the retinoids. This one is a major player in some really important body functions like vision, how our genes are expressed, and our immunity. Look at how diverse its jobs are. It's obviously critical for our vision, but it does so much more. At the cellular level, it actually acts a bit like a hormone, helping to regulate genes and manage cell growth. And on a bigger scale, it keeps our skin and mucosal barriers strong, which is, our body's first line of defense against infection. Next up, we've got vitamin D. You might know it as the sunshine vitamin. Its main job is to act as a hormone that keeps our calcium and bone metabolism in check. You can pretty much think of it as the body's master calcium controller. So its primary function is to really crank up calcium absorption from our gut. This is absolutely critical for our bones to mineralize properly. Without enough vitamin D, you just can't use the calcium you eat effectively. That's what leads to things like rickets in kids and osteomalacia in adults. Now for a really powerful duo. Vitamin E is our main fat-soluble antioxidant. It's like a bodyguard for our cell membranes. Vitamin K, on the other hand, is all about blood clotting. It's absolutely essential for activating some key clotting factors. And from a clinical standpoint, this is huge. This is the vitamin that the anticoagulant drug warfarin actually targets. Okay, let's switch gears and talk about the water-soluble group. If you think of the fat-soluble vitamins as the specialist that get stored away, then these guys are the metabolic workhorses. They mainly act as coenzymes that we use up and need to replenish pretty much daily. And the B vitamins are a true complex. They really do work together. Their biggest collective job is helping us convert the food we eat into usable energy in the form of ATP. This pathway just goes to show how essential these vitamins really are. Just look at how they pop up at every single critical stage of making ATP. You've got B1 and B3 in glycolysis, B5 helping form acetyl-CoA, and then others all throughout the Krebs cycle and the electron transport chain. If you're deficient in just one of them, you can create a huge bottleneck in the entire energy production line. But it's not just about getting energy from food. Other B vitamins are just as important for actually building and regulating complex molecules inside our bodies. So for your exams, you'll definitely want to remember these high-yield pairings. Think B6, think amino acids. B7, or biotin, is a major player in carboxylation reactions. B9, folate, is all about DNA synthesis and cell division. Its deficiency is famously tied to neural tube defects, so that's a big one. And then B12, cobalamin, is essential for keeping our nerve myelin healthy, and it also partners up with folate to make DNA. And finally, in our water-soluble group, we've got the incredibly versatile vitamin C, also known as ascorbic acid. Probably its most famous role is in making collagen, which is just crucial for structuring our skin, bones, and tendons. A bad deficiency here leads to scurvy. But it's also a really powerful antioxidant that works with vitamin E. It actually helps regenerate vitamin E after it's been used up. When you add in its roles in supporting our immune system and helping us absorb iron, you can see just how versatile it really is. So let's wrap this up with a direct comparison. This is all about solidifying these concepts so you can recall them quickly when you're taking an exam. This table just perfectly sums up the most testable differences, and it all makes logical sense, right? Because the fat-soluble vitamins need fat for absorption, they get stored. And because they're stored, they're excreted slowly. And that slow excretion is what leads to the single most important clinical difference, a much, much higher risk of toxicity. And this leads us to a classic exam question. Which class of vitamins has a greater risk of toxicity? The answer, of course, is the fat-soluble vitamins. The fact that they can be stored means they can build up to toxic levels. That's a condition called hypervitaminosis, and it can have some really serious clinical consequences. And that brings us to the end of our high-yield review. Just remember, understanding that fundamental divide between fat-soluble and water-soluble is really the key to mastering this topic for your exams. If you use those core differences as your framework, you're going to be in great shape.
Comment your next topic and subscribe MedX Lab.